Can you please email the group the complimentary mindfulness links you recommended? Yes, I will send you well, I will send you the links, the names of books, so you can purchase them whatever your preferred website or bookstore or wherever you buy books. I will also send you links to guided meditations, but I'm not sure how to send you links for the apps, but I can send the names of the apps and people who have made the apps, so maybe you can find them that way. Please include the recommended authors and texts. The slide with the photos did not include all the names. Yes, no problem, will do. Does mindfulness help reduce impulsive attitudes? So I don't know what you mean by impulsive attitudes, but it does help with impulsivity as such. So if you mean those quick, fast reactions without thinking, yes, mindfulness will, that's one of the long-term effects of mindfulness practice. And it kind of goes back to what I was talking about, being proactive. So mindfulness will not entirely eliminate the way your mind generates ideas. Like I said, we don't really control what our brain does. That is a maybe shocking fact to some of you. It certainly was for me, but we just don't. So you're not going to be able to control the types of thoughts you will have, but you will absolutely gain the ability to control your reactions to these thoughts. So you may think, I don't know, like this guy's being a jerk, but you will not necessarily tell that person that they're being a jerk. So you will be able to find a more, a nicer way or a more appropriate way, or just dismiss the thought altogether. So that for sure. If you meant something else, please, you can clarify, and then I will read it and try to give you a more precise answer. Do you have any tips for maintaining practice? Oh yes, so this is usually a big sort of obstacle for many people. Everyone likes to try mindfulness, especially because it's so popular nowadays. One thing I do is I recommend to people to tie it to their regular routines that they already have. So we all hopefully brush our teeth, and you can do that. What I did in the beginning was that I would do meditations, like that would be the first thing that I do when I wake up. So next to my bed, I have a meditation cushion. And so I just slide from my bed, do the meditation, then brush my teeth and proceed with the rest of my day. And so when I fit it in between getting out of bed and brushing my teeth, both of the things that I have to do every day, it was not that difficult to establish it as a routine, because I would have this dedicated space, and then I would kind of guilt myself into doing it. So that's one thing you can do. So attach it to an already existing habit. Another thing you can do is find a way to make it a pleasant experience, turn it into a ritual. So do it as a part of a kind of self-care program that you can do. So take I don't know, like take an hour for yourself, then do mindfulness, and then do something nice for yourself. You can practice mindfulness in kind of unorthodox positions. You can do that like in the bathtub, for example. If you're taking a long bath, you can do mindfulness there. As long as you don't fall asleep, that's fine. So you can create an atmosphere that works for you. One thing that also you can do is, if you live in an apartment that's big enough, is that you can have a meditation room, or at least a meditation space. So Thich Nhat Hanh, who is quite a famous meditation teacher in his own right, in the Zen tradition, he recommends that you should create a kind of sacred space, under quotation marks, in your house. It doesn't have to be like a religious sacred space. It just has to be your space. Like a place in your apartment where you go to, and then you know that once you go there, that's just time for you and your mind to hang out. So that also helps. Another thing that I would recommend is that you join a meditation challenge. I used to have meditation groups for my former students, and well, I still have one group going. And then if we meet 1 hour or 2 hours a week, we kind of discuss our practice. And then when you have a group of people, and we have a mailing list, and then like you can do that, like find a group of people that would also be interested in starting a practice, and then share your experiences together. Because when you feel like you're a part of something, that gives you this kind of extra kick. If you live in the part of the world where you can still have normal interactions, you can go to meditation groups. Even if you go once a week, that will give you a boost to practice on your own. I mean, meditation teachers are really easy to find. Nowadays, there are many people who charge for meditation. I mean, they charge to teach you, but in my experience, you will find a lot of Buddhists who will just teach you for free or for whatever you can afford to give. This is because I don't, okay, I'll just speak openly for a second. I don't like the fact that mindfulness is turning into an industry, especially because it's a mind training thing that anyone can do at home. So I like to point out all the free resources that you have. You can actually attend mindfulness retreats for free. So there was this Indian Burmese businessman who his name was Genka, or I might be mispronouncing the name because, well, I'm sorry, man. But anyway, he left a lot of money to a foundation that organizes free mindfulness retreats all over the world. So you can get a 10-day retreat or even longer retreats, but at 10 days, they're kind of staple. And you can actually attend that retreat for free. And you get qualified advisors and teachers who will be with you every step of the way. So for example, when I'm in Europe, I have meditation groups that I attend. When I'm in Miami, I have my meditation groups that I like to go to. Some I hold, but I also attend some because I do like to be in the position as well. So that's one way that you can keep mindfulness as a habit, by kind of embedding yourself in that world. Thank you. Well, you're welcome, Jimmy and Crystal. How long do we have to meditate for it to change behaviors? Oh, this is a very difficult question, and it's quite a controversial question. So there are many studies, like I said, that document different effects of mindfulness and different benefits that it gives. But all these studies include like participants who meditate different hours or different minutes. So we don't know what's the minimal dose of mindfulness. Usually, typically what I will recommend is that I see you're raising your hands, so you can also type a message if you, there are too many people on the call to allow for voice messages. I tried that once and it was one big overloading confusion, so please type your questions. So yeah, what I recommend is about 20 minutes per day or more, but people find this to be a very terrifying number. So what I will advise is first establish mindfulness as a daily habit. 5 minutes, fine, but do it daily. Then once it becomes a part of your routine, slowly increase it until you get to about 20 minutes or half an hour. People who teach transcendental meditation, for example, which is not the type of meditation that I teach or practice, but since I've been in this world for a long time, I kind of know what other people are doing. They recommend 20-minute sessions or more. So, and they've been around for a while. My own personal practice is to do two 45-minute sessions per day. So 45 minutes in the morning, and then 45 minutes, which I will do after I finish this webinar. So that's what I do, but you don't have to do that much. 25 minutes to 30 minutes is perfectly enough to get the benefits that I talked about. But what's the minimum dose? I don't know. Maybe there are some studies that came out in the past month or so to answer the question, but I don't know. Do you have any suggestions or resources for people who would like to practice mindfulness but have found it difficult due to past trauma? I have CPTSD and I find mindfulness extremely challenging because I immediately start getting intrusive thoughts. Yes. So this is my responsibility for not including. Thank you for writing this, really. There are some people, mindfulness is really not for everyone and not for every period of your life. So if you have, let's say, a psychotic disorder, even bipolar disorder, before you start practicing mindfulness, consult your psychiatrist. There are ways that you can do it, but you need to find a qualified, experienced teacher, and you need to have an approval from your psychiatrist. So I'm not saying this to be mean, I'm just saying that mindfulness is not without its side effects. And again, thank you for reminding me. There is a book, I will tell you right now because it's on my Kindle. There is a book specifically dedicated to people who have PTSD and who want to practice mindfulness. Just give me 1 second, and I will tell you what the title of the book is. Oh, here it is. 1 minute. Dun, dun, dun. I'm sorry. Oh, okay. I may have removed it from my. Okay, so yeah, it's called Trauma Sensitive Mindfulness by David A. Sorry, an audiobook. Apologize. Yeah, so it's called Trauma Sensitive Mindfulness. If you like, I can send you a link. Just email me. You have my email below. It kind of explains how to adjust mindfulness practice for PTSD. But I think even better thing for you to do is to find a teacher that will guide you. You will be surprised how many remarkably qualified and famous teachers will agree to work with you if you just send them a polite email. So some of the teachers, although they are Buddhists, that might be able to help you. Um, there is something called the Sangha of Awakened Heart in the UK. They give online lessons for like a small donation, and they have very qualified teachers, and they will be able to help you. Sharon Salzberg is a teacher that has infinite experience and a big gift for teaching. So I think, although she has some health issues, so I don't know how available she is, but the Insight Meditation Society that she helped found will also be able to direct you to someone. There's absolutely no reason why you shouldn't practice mindfulness. It's just about finding the right approach and a teacher who's going to kind of dose the exercises specifically for you. So the book that I recommended can be a good, it can be a step in the right direction, but I still think you should find a teacher that specializes in this. Is there any evidence linking meditation with a lower prevalence of Alzheimer's and dementia? On top of my head, I am challenged to say no, but I cannot be absolutely certain. I have two conflicting pieces of evidence to give you, so make what you will of it. There is a study that I read recently that connected certain types of mindfulness practice with false memories, meaning that perhaps it can interfere with memories. But then again, we already know that our memories are not very um, reliable. But on the other hand, the fact that it helps with neuroplasticity, the fact that it creates a thicker prefrontal cortex can indicate that it might help with Alzheimer's and dementia. There is some work on mindfulness, but not mindfulness practice the way I talk about it. And if you read a book called Mindfulness by Ellen Langer, she talks about how mindfulness can help alter and slow down aging. And that also includes cognitive aging, not just physically aging. But she doesn't use mindfulness exercises. She just sort of studies mindfulness as a phenomenon. She's also a great speaker, and she has a lot of interviews and TED Talks, so I really recommend it. So her name is Ellen Langer, and the book is called Mindfulness. It's a very, very interesting book. It will not teach you how to meditate, but if you're interested in the possibilities that mindfulness opens, she's both very much sort of fact-based and evidence-based, and she's a long-time researcher, and she also has imagination and is able to see past the concreteness of science sometimes. So maybe that's where you can find an answer. What made you want to do mindfulness? Well, to get out of class, to be perfectly honest. So I was practicing mindfulness. I learned how to practice mindfulness when I was in high school, because there was like a study that someone was doing as a part of their master's degree or something about how mindfulness affects learning. And that got me out of a class that I was bored to death with. And so I was like, why not? You know, sitting with my eyes closed cannot be more boring than listening to that class. And then when I went, I had like this brief little experience of 5, maybe 10 minutes of a guided mindfulness exercise. And when I opened my eyes, I could literally see colors differently. And I thought, I don't know what this was. It seemed so ordinary when I was doing it, but I want more of this. And so I was hooked for a while. But since I was in high school and I was a teenager, I didn't really establish it as a habit. But then when I started medical school, I realized that I need something to get me out of my head and to help me deal with the stress. And I just kind of spontaneously thought of mindfulness, and I just kept doing it. So I often really honestly don't even know how to explain why I do it. I just really enjoy doing it. But that's my, let's say, that's the most coherent narrative that I can assemble. Do you have any experience with Vipassana and would you recommend it? Yes. That's the brief answer. I already recommended the Vipassana retreats that are free. And Vipassana is essentially what we mean when we talk about mindfulness. So yes, absolutely. Vipassana is a really nice kind of, if I had to simplify Vipassana endlessly, that would be a way to balance concentration and awareness. If you remember those two things that we talked about. So it's a really simple technique, but not easy to master, and it's very useful. And yes, I would absolutely recommend it. Yes, I don't think there's any benefit that mindfulness offers that Vipassana does. It's so similar that I sometimes even use the terms interchangeably. What do you think of the growing body of research indicating fundamental mental shifts, including towards spiritual breakthroughs, similar to what one can attain through meditation from psychedelics like LSD, MDMA, and mushrooms? I like that this line of research is reemerging now, and that you actually have very good studies studying the effects of LSD and mushrooms. I find it really exciting. I think it confirms a lot of the experiences that we meditators have, and that much more experienced meditators than I do have. I don't think I would volunteer for any of these studies because one of the things that meditation has done to me is that I have no interest in experimenting with psychoactive substances. I'm really happy with my brain the way it is. But I can see how they can be helpful for depression. I can see how they can be helpful for anxiety. I can see how they can, I mean, when I say I can see that there's at this point, there is actual research that shows that microdosing with psychedelics can really be beneficial for your mood. I can see how using it in the traditional sense of the word, like with all the rituals, like ayahuasca and all these things, I can see how it can be psychologically very beneficial. So I'm in that way maybe a little more liberal than most of my colleagues are. I have absolutely no, I mean, whatever grown-ups do, I'm fine with, and I think it can be quite interesting and give you a lot of good material to work with. I think it's best coupled with therapy, done by someone who can guide you through the process. And I also don't think it's for everyone. So again, if you have a diagnosis that might make you prone to psychosis, for example, I would be very cautious with these things. But otherwise, by all means. What time of day do you personally meditate at? It's first thing in the morning? Is it before or after shower? What event? So I described the morning part. So my morning meditation is fixed. So as soon as I wake up in the morning, and I wake up incredibly early, which if there are some of you in the program, you know that I answer at really ungodly hours, but I just wake up very early. And so the first thing that I do is I meditate and then proceed with everything else. And then my second meditation of the day is usually fluid. So I don't have a set time to do it. Today I will do it when we finish. But for example, yesterday I did it at like 11 p.m., I think. And then the day before it was in the afternoon. And I also try to meditate longer on weekends because that's my time to recuperate from the week. And sometimes if I can, back when we had normal lives pre-COVID, when I had my, like face-to-face sessions with clients or in-person sessions, I would sometimes try to leave periods of like 20 minutes or half an hour in my schedule so that I can fit in a short meditation session so that I don't get tired and so that I can kind of able to focus more on, or better rather, on what my clients are talking about. So I also fit these short sessions as well. Please let me know the medical term for this. My hands are awful. My anxiety is a high, and my hands tell the tale. Do you mean that your hands are shaking? Or I'm not sure I understand the question. So if you can rephrase it, I will. But if your hands are shaking, yes, this can be, this can be a visible symptom of anxiety. I had a very long breath hold today while doing pranayama. A term in parentheses, which I will butcher if I try to pronounce, Kapalabhati, maybe. and it was very pleasurable. But it did surprise me as it just sort of happened and kept going. And my story made me think of. When you observe your breath, you will notice that our breathing really changes a lot. If you're anxious, you're obviously very likely to breathe faster, and your breathing will become more shallow. If you're relaxed, it'll be slower and deeper. But that's not the only variations that we have. So the more you observe your breath, you will learn that it varies a lot. So yeah, you can have a spontaneous kind of deep and long breath, but that's not what I was talking about. In my experience, I actually exhaled, and then there was a long period of time before I inhaled the air. So that's the part that kind of got me worried. Also, one thing that I failed to mention about the breath, and you just reminded me, so thank you. When you master, or like if you practice mindfulness of the breath as part of your regular practice, you can actually use your breath as an indicator of how anxious you are or what your emotional state is. You can also do that with body scans. As you practice, you will learn that certain parts of your body are more likely to react when you're stressed. So for example, I've noticed lately, and this wasn't the case before, maybe in the past few months, that when I'm starting to become stressed or tense, it's my neck that hurts. That never happened before in the past. Usually it was either my shoulders or my lower back, but now it kind of moved here. So I kind of check in with my neck during the day a few times to see if I'm stressed, and then I try to do something to prevent my stress levels from escalating. So you can do the same with any, of course, body part where your stress can occur. And also, you can do that with the breath. If you work, for example, or you have a meeting, and you can just check in with your breathing while someone else is talking, or even while you're talking, and see the rhythm of your breath. And from that, you can deduce what your emotional state is. So that's one way that you can incorporate these little moments of self-care with mindfulness throughout the day. I have a loved one who is deeply affected by this. How can I support them? You mean by skin picking, I suppose. So I think the first thing that you should do is to ask them if they need help and what kind of help they need. When I talk to clients who pick their skin, one thing always stands out, especially if they're younger, is that their parents put incredible pressure on them to immediately stop picking or to just stop. When people use just next to pick, it makes me upset, because if people could just stop, you would. It's like telling someone stop hallucinating now. So one thing is talk to them, tell them that you're concerned, and then ask if they share your concern, and then ask how you can help. Sometimes people can actually use a partner to hold them accountable, a partner to make them more aware of picking, but sometimes they prefer if people say nothing, because when people say something, it kind of adds to the pressure and then makes them more anxious and therefore more prone to picking. So talk to that person and see what kind of support they need. Because even with the best of intentions, if you offer people the kind of support that they don't need or can't accept at the time, you're not doing them any favors. If you, for example, wanted to offer them your help or, I don't know, treatment or something, and they're not ready for it, you will create resistance around that. And when you create resistance, you're actually prolonging the period for them to realize that they need help or to become ready to get help. So it's very important to just see with them what is it that they need, and then see if you can give it to them. Just listen. That's what I would suggest. How does skin picking lead to dermatophage? Okay, so swallowing or eating or chewing on pieces of your skin afterwards is not a separate condition most of the time from picking itself. It's usually the part of the ritual. This also very frequently happens with people who pull their hair, and then there will be a part where they will either swallow the hair or just do something with it as a part of the whole process. I don't think it's necessarily to swallow your skin is not as problematic as to swallow your hair, because there are no complications that it can lead to. But what I would invite you to do is try to skip that part of the ritual in the future. And then see how you feel, and see if this is a necessary or a kind of just an addition to the ritual of picking. And then if it's an addition, remove it. If it's necessary, or if you will know that by whether or not skipping the part where you chew on the skin, if that part, when you skip it, if tension is still relieved, that means that it's not mandatory, it's optional. And if there is still tension in you, then it's worth thinking about sort of what it means for you to swallow your skin, because it can be psychologically meaningful, but it's not necessarily problematic. It's just that it has a specific meaning for you. It doesn't complicate the treatment in any way, if that was your question, if that's what you meant when you said problematic. So it's not going to cause any health concerns, other than, of course, increasing the likelihood of an infection if you bite off a piece of your skin. But you can reduce that by taking care of the wounds that you create. But it is a psychologically significant part. That's how I would phrase it. Where do I find information on the free mindfulness retreats? I believe it's dharma or dharma.org. That would be the website. Just try Googling Goenka, so that's Goenka Vipassana retreats, and it should come up as the first thing. They have retreats all over the world, including a beautiful one in Florence, but there's always a waiting list for that one. So you can choose the location as well. I have a skin issue that has been undiagnosed properly. It becomes worse under stressful conditions. Yet find it more stressful that I'm not being taken seriously. I'm a nurse, I'm in tune with my body. How will mindfulness help me with this feeling of hopelessness as I'm feeling disempowered by doctors in the Western medical system? I'm really sorry about this. So I don't know what condition it is, but first thing to do is to find a doctor that is going to take you seriously. Now, the doctor may not agree with you that you have a medical condition, but if a doctor is just dismissing you, not taking you seriously, then that's not the right doctor for you. It's very simple. I think the same goes for therapists or any other kind of health professional. We may not always be able to give you the answer that you want to hear, but if we're not taking you seriously, we're not able to give you any answer that's reliable. So first, find a doctor that will take you seriously. That's one thing. Second of all, mindfulness may not be able to help you with, obviously, the skin condition. It can help you cope with it. It can help you with the stress and the anxiety surrounding it. But I don't think if it's a condition that's autoimmune, if it's a condition that's stress-induced, maybe mindfulness can kind of help you have fewer relapses by regulating your stress levels. But I don't think it can't heal your skin condition, unfortunately. What suggestions do you have for someone with difficulty breathing, like COPD, who has anxiety from breathing difficulties? Does this cause more anxiety to focus on the breath? Actually, no. So in the beginning, I can understand how that can be an additional cause of anxiety. But remember, in the long run, mindfulness will reduce your basal anxiety levels. So you will overall be less anxious, which means that your breathing will change accordingly. If you have COPD, for example, or any other type of obstructive lung disease, being calm, or any other lung condition, period, being calm and being able to it will really allow you to breathe as best as you can possibly physiologically. So it can be helpful. But again, like with trauma, this is a matter of how to approach mindfulness in a way that it doesn't make you panic. Because if what troubles you is how you breathe, then what troubles you is accepting your condition, not mindfulness in itself. So it's important to find a way around this. Maybe you can actually begin by doing body scans, or a type of mindfulness that's focused on visual stimuli, or maybe sounds, or perhaps even loving kindness or compassion, one of those phrase-focused mindfulness exercises. So that way, breathing will not be in the forefront until you're ready to put it there. But at the same time, it will have the relaxing effects and then allow you to breathe freely. One of the things, I don't know how much you followed the whole thing that was happening with COVID and all these kinds of alternative treatments. And then I read somewhere that someone said how deep breathing will help you deal with COVID. And of course, deep breathing does not cure viral infections, at least not as far as medicine is concerned. But deep breathing will help you because it will oxygenate your lungs properly. So mindfulness can help in that way, but that's like symptomatic help more than anything else. Okay, so this was the question you answered. You should recommend tarabrack.com, especially around mindfulness, with a lot of attention to possible trauma. Yes, so I did mention her books. She also has a website that has, I guess it's free to say, dozens and dozens of pre-guided meditations. It's tarabrack.com. She also is, in my world at least, famous for the rain practice that she promotes and teaches. So that's also something you can benefit from. I talked about rain in the previous webinar about emotional regulation a little more, so I wouldn't go into any details here. You can look up that webinar or simply her website. So I do recommend it. I'm personally not the biggest fan of the way that she guides people through meditations, but that's just my taste. Not everything has to be, my flavor. So maybe she will actually be just perfect for you. There's another website that you can also look up. It's selfcompassion.org with a hyphen. It's Christine Neff's website, and she's also quite a well-regarded, well-known researcher, and she has a few free guided meditations that you can download. They all concern self-compassion one way or another. Can you spell Ellen's last name? Oh, Langer. It's Langer. So Ellen Langer. She was a professor at Harvard, I think. She's a very interesting speaker. I've had the pleasure of hearing her speak a few times, and you can also find her stuff online. She's very engaging and has a great sense of humor. Okay, so I answered this identical question a second ago. I suppose this was posted accidentally. I have eczema, which is exacerbated by my skin picking and vice versa. Can mindfulness help reduce the itch that leads to scratching, which in turn sets off skin picking compulsion? So my answer is a very decisive maybe, and let me explain why. Mindfulness has some use with people who suffer from chronic pain, not because it makes the pain go away, but because it allows you to treat pain differently. So it redefines the way you relate to the pain. There's no reason why it couldn't do the same thing for the itch. So it may not take away the itch, but it may help you withstand it better. That's one part of my answer. The second part would be that sometimes itch doesn't just necessarily come from the skin. It can also come from anxiety. One way that anxiety, it's not the most common symptom of anxiety in the world, and it's a relatively low-grade symptom, but it's annoying nonetheless, is that people can get itchy all over their skin, for example. And then the more you scratch, the more it itches, and then it goes on and on. So that can also be in part due to anxiety. So that's definitely where mindfulness can help. If eczema is producing the itch, and if you have a dermatologist, you can ask them to prescribe something to alleviate the itching. And there are also over-the-counter medications for itching that you can use, or at least try to use. Unfortunately, in my experience, they're not, dermatology was a long time ago, but they're not terribly effective, if I remember correctly. Do antidepressant medication hinder meditation benefits? No. Psychiatric meditation will, to an extent, alter your experience, although usually in a subtle way, but not of meditation, but of living. So meditation will sort of show you and magnify what your experience is like. The only possible, I can imagine that antipsychotic medication in some instances could hinder your meditation because they can kind of make you slower and maybe a little sluggish, and also they can make you sleepy, and I can see how sedatives can alter your meditation experience by making you fall asleep, but antidepressants should not have that effect. So the meditation is supposed to help you observe your experience, whatever it is, right? So antidepressant experience included. Excellent session. Thank you very much. You're welcome. Can you see my question or are you just skipping it? I guess I cannot see your question or I may have answered it already, but I'm not skipping any questions. If you left your question in the chat, then I did not even open the chat yet because there's about 20 questions that I still didn't get from the Q&A. My hands healed up after a bad bout of dyshydrosis, but have bouts of bad picking and wear Band-Aid all the time. I tend to pick when I'm driving or watching television. So would mindfulness maybe work when I realize this is happening? When you realize that this is happening, what would help is to use a competing response. That's the best immediate thing that you can do. Mindfulness, when you practice it regularly, can help you be more aware of what's happening. So you can catch yourself sooner or before you start to pick. I'm assuming a lot of your picking is mindless or automatic. So that's where it can help. But if you catch yourself happening, my God, sorry, I think my brain is melting slowly. So if you catch yourself picking, then competing response is your immediate go-to. Also, some techniques like cognitive diffusion that you learn about in skin pick, but that's I don't know that should be a go-to without practicing. But if you're in the program and you went through session 6, in these situations, first you apply session 6 techniques, then session 3. But competing response nonetheless should be the staple in these situations. In fact, what I would suggest is that you should practice competing responses even when you don't feel the urge to pick. Because a competing response is supposed to be a new habit that you establish. So you can practice competing response, especially if you use squeeze toys or I don't know, worry stones or whatever you use. You can play with these things even when you don't feel the urge. So the more you do it, the better. Should I let them continue doing it? I'm not really sure what this refers to, so I don't have context, I'm sorry. My parents always tell me to stop picking when they see me doing it. Do you think this helps or makes it worse? The question is only how you feel when they do that. If you feel anxious or angry or ashamed, then they're not helping. Maybe what you can do is think about, do you need them to point it out? And if they don't point it out, will you still try to stop? That's very important. And if they can actually be helpful, then just think about how they can be helpful and then try to agree with them that that's how they should do it. There are subtle ways that they can let you know that you're picking without insulting you or embarrassing you. That's what I was trying to say. And they should respect that then, because if they want to help you, they should help you in a way that makes sense to you. Keeping a regular practice of meditation, yoga, asanas, and yogi breathing, pranayama, has really reduced my finger picking. When you see how the mind jumps around and thoughts come and go, you become more aware of what you're doing to yourself. It makes it easier to show care to yourself. Yeah, I agree. I think for me, as part of my training to be a therapist, I had to go through, because my training was in Europe, we usually have to go through mandatory therapy. So I was in therapy, it was mandatory for over 5 years. I think I didn't learn as much about my brain in all that time as I do when I meditate. Because when you see your brain working in real time, you realize what a cesspool that really is. And you wonder, like, is it possible that these thoughts are coming out of me? And then you suddenly change, like you stop taking them seriously, and you kind of develop, like you start feeling bad for yourself, and you start caring for yourself more. So I agree perfectly. That really is my experience with thoughts as well. Like sometimes, even to this day, after all these years of doing mindfulness, I sometimes see a thought like fly by, and I think, really, that is a thought that you have? Like, why? But there is no answer to that. Okay, so this was a comment. You're welcome. The chewing is the best part. So, oh, I suppose this is a continuation of the other one. if chewing is the best part, then focus on how it makes you feel, and specifically on your body sensations. And then think about what else causes these types of sensations in you. That way you will be on track of finding a replacement for that aspect of thinking. Oh, someone was correcting my pronunciation of the gentleman from Burma in the meditation center. Thank you. Is skin picking OCD? So skin picking is a separate condition when it comes to classification in the DSM, but it does have some overlap. That's what we know from research. It has some overlap with OCD, but it is a distinct condition. So we can say that it's on the OCD spectrum, but it's not OCD itself. I hope that clarifies it. I have been taking antidepressants and I'm finding my BFRB is seriously increased. I went to a doctor who recommended my dosage is increased, doubled as well. And I was given a referral to the mental health department, which I needed due to having recently moved to a new location. Would you recommend increasing the dose or wait and explore mindfulness? I don't want to hinder medicinally. What I need to do is heal my obvious pain that the picking is a symptom of. So even though I am a doctor, when I kind of function in the therapy mode, I always insist that I split this part with someone so one person does the medication, the other person does the therapy. I find that this works better because both approaches require different ways of thinking. And then when two people do them, we exclude all biases, because I've noticed that I tend to have a bias towards psychotherapy. But that bias doesn't necessarily mean that it's really good for other people. So what I would recommend is that you do both. Even doubling the dosage of your antidepressants doesn't exclude the possibility of meditation. So you can do mindfulness. And in fact, what you can also do is therapy. And if you have, so I don't know where you're from, but if your health insurance covers therapy, or if you can afford the skin pick, I would advise that you can combine meditation and therapy and all of it. So I meant to say meditation, medication, and therapy. So yeah. So for skin picking, I can't think of a study right now, but I know that for anxiety and depression, there are studies that show that when you approach it from different perspectives at the same time, you get synergistic results. So you get better results than if you just do either one. Thank you. You're welcome. Every Saturday, 1 p.m. Eastern US time, Tara Brack has a Satsang with Q&A where people tell their issues and Tara responds. A lot of your audience here may find it helpful. There's a $5 minimum donation. It's interesting. I'm also not a huge fan of her style, though. But she's a very competent meditation teacher. Tenzin Palmo, a British Mahayana Buddhist nun who was in a cave in India for 12 years and now raises money for a nunnery in northern India, is also someone who I find very impactful and clear. Yes, Tenzin Palmo is just an extraordinary woman. This is just I can't help but I'm a huge fan, I guess. The reason why Pema Chodron is also an excellent meditation teacher, and Chogyam Trungpa Rinpoche, who is no longer with us, but is also an extraordinary teacher, and his writings are really very helpful. And there are many great teachers out there, but what they teach is explicitly Buddhist mindfulness. This is why I didn't mention it, because even though I don't mind it, I don't want to impose these something that is a religion onto other people. So I just stick to the secular part. But Tenzin Palmo is a remarkable teacher. First of all, the fact that she spent, you say 12 years, I'm not sure about the number, but in my mind, it's almost 2 decades in a solitary silent retreat in a cave in the Himalayas. I think just an impressive woman. There's also a documentary about her that you can watch on YouTube somewhere, I believe, and there's a book written about her as well. She's a fascinating person. And she's also a very good teacher. If you're interested in learning about an explicitly Buddhist approach to mindfulness, she has a series of teachings you can find on YouTube about Atisha's mind training, which is really very interesting. And Pema Chodron also has a lot about Is the skin picking program, I'm just learning about it now, something that can be covered by insurance, such as a therapist? That depends. I think the best thing I see that it depends because some insurance companies will reimburse you for skin pick, so you pay and then we issue an invoice. Well, not me, someone from skin pick will issue an invoice, and then they will reimburse you. But not all companies will, so it's best to check with them. Some in the past, I know because some of my clients have told me this. Some companies have even covered skin pick for longer than 8 weeks because the program works. Basically, you subscribe monthly. To complete the program, you need 2 months, but some people who can afford it choose to stay longer and then have someone to hold them accountable and work through different issues. Some insurance companies in the past have covered it up to 6 months, I believe. So that's definitely something to look into with your insurance company. Do you find it helpful in making progress for people in your psychotherapy practice to have clients, patients who are doing regular meditation? Absolutely, yes. And I encourage it, and I often suggest it myself in the beginning. When it comes to skin pick, mindfulness is already incorporated into the program, but because that's part of acceptance and commitment therapy, but it starts officially somewhere midway through the program, and it's implemented slightly differently than what I was talking about here. So I advise people to start a mindfulness practice, like a formal practice as well, because I find that it helps us decipher and understand the emotions and thoughts behind picking. So it gives us more material to work with. Absolutely, yes. She got 12 years for sure. She got booted out of India for overstaying her visa by 3 months. Yes, I remember she was in an interview, she talked about this, yeah. But anyway, she's quite an extraordinary woman. Yes, my insurance covered it. Someone said so. Your insurance can cover it. Thank you again. You're welcome. Okay, so I already answered this question. So I think I think we covered all the questions in the Q&A section, and I think maybe I see that there's still quite a lot in the chat, but I think maybe this is a good time to stop. If you have any questions that I didn't get to or that I didn't see because someone said that I'm not answering their question, which wasn't on purpose because my Q&A is now clear. You can email me if you have any technical questions or questions about the program or payments. You can write to our support, and someone will get back to you fast. So this is the code. Also to remind you once again, you can use. This is a really good discount. So I'm kind of surprised. This is more than what they used to give in the past. Oh, another Q&A. Okay, just this one, and then we'll stop. Thank you. You're welcome. So let's stop now, and I hope to see you next month. The topic will be habit formation and habit change. So it will be a very practical session. And then, anyway, I hope to see you there. If you have any ideas about what we could talk about in the future, you can also email me with your suggestions, and I'll be sure to take them into account. So thank you all again, and have a pleasant evening.